Dr. Shibra had spoken initially on how to assess, that was a clinical assessment. Now, as said, either the child is normal or does not have any disability, but still we do have restrictions in our own clinical setups, like how to take out the vision. Now, we have these different conditions, the child with autism, the child not having eye contact, or we have a fundus like this. Visual acuity cannot be demonstrated, or it is difficult to take out the visual acuity. So what we can do? So what to do? Is the child having some vision? If yes, then how much? Should I label him as low vision or blind? Or what should I tell the patient? So there are many questions which come when we do the pediatric assessment. You can see some spectrum, dark light. So it's not the visual acuity. It is the functional vision, the visual functions. That is called as elements of vision: light, contrast, color, size, distance, position, familiarity to the object. So basically, in functional vision, we don't talk on any acuities. We don't talk on any charts. Nothing on that. It is the vision which the person is having or the child is having, and how much is there and how much the child is using, and how, if it is using, then we have to improve from grade 1, from grade 3 to 2 to 1. There are 3 grades in functional vision. Grade 3 is poor, grade 2 is moderate, and grade 1 is mild. So aim is to improve from 3 to 1. That is functionally. How many of people have you visited any blind school? Yeah. So you must be seeing, though that these children they are blind, or they are very, very severely low vision or severe visual impairment, but see how they are walking on the steps, they are running down and left and right, and like they are enjoying the environment. Why? Because whatever vision they are having, it's a functional vision. Though vision is 1/60, but the functional vision is very good. So why do we do functional? The importance of functional vision is to form a baseline, to determine the current level ability or the ability to see, to plan early intervention and develop individual educational plan, and to plan for vision training and use of devices. Here both, how to use the vision and how to use the devices, both. When we have to do, whenever the child is diagnosed as having visual impairment, whenever there is a change in performance or previous assessment has not been done. Who can do it? The people who know how to do it, like special teachers or orientation mobility specialists, low vision therapists, and a rehab person. So what does it include? It includes a performance in varying environments. Here we have to do in actuals. See, many times we say your child is, my vision is 6/36. But what is the actual vision? Because patient does not understand 6/36. The child does not understand 6/36. So we have to do an actual assessment. Okay, what size of the ball or what size of object the child is able to see, at what distance, what color, lateral visual field, peripheral visual field, central visual, because there are some midline problems, midline brain problems, where the child is not able to, you do your vision assessment in the center, but the child is not able to see in the center. So we usually have a tendency, vision cannot be elicited or the child is not cooperative. Why? If the child is having midline problem, he is not able to see in the center, and if you do the vision assessment in the center, you will never get results. So only by functional assessment you will come to know, also vice versa. You will come to know, is the child having any midline problem? Is he using his peripheral vision more? So this helps us more in functional vision. So, and again, when we say our child N36, mother does not know N36. She is juggling to let the child to do the homework, but she is juggling, and we have written on the report N36. What is this N36? So we have to do the assessment, what type of print, what type of size the child is able to read, how dark the child has to write. So these are the things which we have to tell in function. We have to assess in functional vision and do the vision training. So what are the components? History taking as usual. It's the best thing which tells us how the child is using the vision and how where we have to help them. Eye structure, posture, this is all important. Environmental like color, contrast, light, illumination, size, distance. So in functional vision is basically we have to play with the elements of vision or the visual functions which are there to assess them and train them how to use it. So in functional, other things are like how can they recognize objects, visual discrimination, are they able to discriminate between a circle and a square? Because for a low vision patient, everything is very hazy. Then exploration of objects, are they able to first touch it and then see it? There are some patients like with mobilities, they usually take the object, put it in mouth, and then they try to gaze at it. So these type of behaviors also we can see. Check for cognitive development. Any component which was omitted can be again, like in ophthalmology, if like clinically if we cannot see, then functionally we can see. So how to assess? Always start with big objects, then go by small objects. Then start with simple, then go for more complex. And again, observation and documentation. Observation and documentation is a must. So when we see, again, functional vision has two components. One, as we saw, it was the visual function, that is color, contrast, and illumination levels, size levels. Another component is visual skills. Now, what are visual skills? There are 7 areas of visual skills. One is awareness, tracking, scanning, discrimination. All these are 7 areas. Now, awareness helps us to know the environment. Tracking and scanning. Tracking, again, if we have this visual skill, it will help us to read, write, and mobility. Scanning, again, it will help us. It is very helpful in mobility. And again, for children, it is very important. If they are able to scan properly, then they can copy it from the blackboard and write in a copy. So you require scanning, that is shifting of gaze. I'll describe it in detail. So first is how we have to check for attention. Take any object and at 1 meter distance and ask the person to see. If the person is able to do at 1 meter, then keep on shifting it. Then you can change it from 1 meter to 3 meters. So in this way, you have to check for attention if is the child able to see it or not. And then note down your findings. Always, again, in functional vision also, it is very, very important to note down the findings. Because as we know, vision is a continuum. It may keep on changing, so you have to keep on doing it. Then once we have seen the attention, is the child able to reach it? So take some object, keep it on a table or in your palm, and then you can see if the child is able to pick it or not. So is the child able to reach it or not? If the child is able to reach, then his visual area number 1 is good. Then second is tracking. You throw a ball and then roll a ball and ask the child to go and pick. If the child follows it and goes and picks. So always, again, in this you have to see how they are following it. Are they bumping the objects in between, or they are directly going and picking it up? If this is good, then tracking is good in this patient. Then later on we might have to go for a minute changes in their functional vision. Then gaze shift is there. Like take one stand opposite, take an object and then ask the patient to look at it and take it in another. Again shift this object to the other hand and then see. Do it with one hand and in all the directions and see if the child can follow it. Then scanning is shifting of gaze to take 2 different things and ask the child look at red color, look at blue. If the child is able to shift that thing, then okay, this is the functional vision of grade 3 where they are able to do. Then you do with small objects and then from big to small objects and see where is the problem happening. If they are able to recognize big objects, then do it with the smaller objects. Then again changing in fixation, like whenever this is again required when you have to look at far and then you have to look at near. So especially reading, writing skill. Then see for discrimination of objects, if they are able to find objects, like you can keep some 2-3 chairs, keep other ball or any other object in between to check for discrimination. Then discrimination of follow the path. Again, this is again required for us to walk properly whenever there is obstacles. Keep some 2 or 3 objects and then ask see how the child is able to negotiate in between. So again, why we are discussing, because all this visual skills help us in mobility and make us more independent. And discrimination of identifying actions. Again, this is very, very important. Facial expression. Why? Because social interaction is very, very much required. And again, this discrimination which is there for matching size and it is required for reading and writing skills. So that is why you have to look at what is the amount of size the child is able to see. Small size, if a child is able to see 2 centimeter reading material, so we have to tell to the parents that okay, you have to write that big. So whenever we are doing assessment, like if we see that the child is contrast is poor, then we have to go for dark pencils. You can start with black marker pen and then go with a sketch pen, then go with a double B pencil, and then you can go with your normal HB. So it requires lot of sequence of training. If the child is not, the parents come and then say, the mother says that the child is not able to write in the book. So you have to highlight the lines which are there, make it more darker, and then you have to train that child how to read and write. So once you have done the functional assessment, you can do an individual plan for that particular child and then give them a guideline. So this was about functional vision. Now coming to vision stimulation. What is vision stimulation? Nowadays we are working, lot of good results have been seen on this vision stimulation. These are basically different type of exercises which we give to children to improve the functional vision. Now once we have improved the functional vision, then we can go to the visual acuity, because visual acuity is a very high grade of functional vision, we can say like that. So these are the different tests which we can do, and the same tests can be helped to improve their vision. So this is like light. When we do the vision stimulation with the light. Now this is a child where we have to take a dark room and start with the torch light and then go for colorful balls. And this has to be given around 10 to 15 minutes or maybe half an hour. In one session we give them, or tell the parents to do it at home. At least 2 to 3 times for at least half an hour to 20 minutes. So these are different techniques. This is again a card which is available. You can go with single light, then go for multiple lights, where you can show the light through this apertures, colorful apertures which are there. And so start with red, yellow light, then you can shift your light to multiple. So in this way, the child learns to look at the light. The first functional vision which we saw, attention and identification. So if the child is trained how to see, this will require time. Sometimes we lose heart. It can take around 6 months to 8 months to 1 year also for the child to develop fixation. And I was very, very much surprised initially. Being an ophthalmologist, we usually don't concentrate on all these things. But when we get parents telling us, doctor, initially to my child was not able to look at the light, but after doing this exercise, now he's able to follow the light. He's able to, I can play with him with the lighted toys. He's able to do it. So this is the positive thing which I get, and then we start. So this is the first step of vision stimulation, that is light stimulation. And I think so all who people have a low vision clinic and working with Dr. Lango, Dr. Shubhra, do have this experience of vision training, and it really works. So these are the different light stimulation. Then once we have done with light stimulation, second step is to go with large image stimulation. Nowadays there are on YouTube also you can go and find out different types of videos which are available where you can use for your patients also. So that was for light stimulation for identification. Then coming tracking and scanning exercise. So these are the different the color contrast charts which are available, where we can help them to do it. again telling them to identify it. So sometimes we have to start with good illumination. Then they can be like, you can use a tactile sensation also. Take the child's hand and put it, and then let them feel that this is a round. Then once you have done this, then what you have to do, you have to with your own finger make a round on your child's arm. So this will help them to, this is a visual stimulation, touch stimulation which is going at the brain. So this helps them. You have to tell to the parents that these are the things you have to keep on doing with them. So once they have done it, tactile, after tactile, you do it with colorful objects. Then you go on black and white, that is 3D. So this is a 3D vision stimulation. Then you have to go on 2D, that is to make it on paper. Round, big round, then small round, then filling of colors. So there are multiple things which are required for vision, like from coloring, writing, everything is required. So similarly, we have to train these children to do it. The child might to have, it might have to be done at a very near level also. Don't do it that the child has to sit. They may take it more closer and do it. So encourage them to do it, but always correct refractive errors first. Then teaching them eye-hand coordination. Again, this is a very, very important exercise which is required for reading, writing skills once the child grows up. So these are the type of simple beads which are there. And this is you can tell them, now we have those clay, children play with clay. So you can tell them to make it A, B. Again, don't start with ABCD. That is the worst thing to do. Start with simple. Standing line, horizontal line, diagonal line, square. So because these are the things which develop first. ABCD never develops first. And again, there's a study which they have shown what sequencing of alphabetical letters you have to, A and B are the third most in the line to be taught to the low vision child with visual impairment. It is always, we have to start with O, I, where the sequencing is very, very simple. So we have to go in a different phase in teaching vision training is to be done. So these are all eye-hand coordination exercises. Simple beads are there. You start with these bigger beads, then go to small beads. So I tell to my patients, Allah, mere liye mala bana ke leke aana next time. So they do it and then bring it. So you can help them to how to improve the contrast. Tell them to write in all this small and slowly. See, again, it is not that lifelong they'll do this, but once they learn to see, our main aim of vision therapy is to help them to see. And these are very, very simple steps. There is no like hi-fi toys or any tests required. Again, reading, writing skills. This is made by a low vision patient. See, we tell them to go for these type of books and let them, you have to make it dark and then make it then straight and then round. So these are different type of books nowadays available. So this was an example of a child. Just last week only came, I told him, he knows about writing and all. So see the writing when the lines were not dark and see the writing when the lines were made dark. So this is a difference which makes them. So if the child is not encouraged, always his writing will be at this level. But if he learns, now see, this is within half an hour he did that. But if he keeps on doing it, that only we have to tell to the parents that you do it first. Once they do it, then you can shift them to the normal thing. So this is these are the two paintings which are being made by my low vision children, Vision 6x60. And this is a writing of one of the child which is 6x60. She has been following me when they were 3 years old, and now the child is in class 9th.